I can predict when you're going to have knee pain and what kind of knee pain you'll have. When you're 12 to about 16 years old, you're likely to have something called Osgood-Schlatter's disease. What this is, right where your tendon from your kneecap attaches to your shin bone, right here, the bone gets pulled and yanked because the muscles that are up here in the thigh are pulling up on it. And so you start to get tenderness, pain, discomfort, and because at that age, between 12 and 16 years old, your bones are still growing, you start to yank on this bone and people will actually get a bump, and that bump will solidify and you'll have it in old age. It's actually something that I have myself. If you make it past 16, what you'll likely end up having then is something called patellofemoral pain syndrome. So that goes on from about 16 to 25 years old. That's called patellofemoral pain syndrome. And what this involves is, here's the patella, here's the kneecap, and it sits against your thigh bone right here. And when there's a lot of tension from the quads up here, because they're pulling, they're usually very, very strong to dominant, they start yanking this tendon upwards, which pulls the kneecap against the thigh bone and makes it rub too much, excessively. That irritates the back of the kneecap. It irritates the tendon right here where it attaches to the kneecap, and then the ligament right here where it goes from the kneecap to the shin bone. So you can get pain anywhere in this region, and they'll call that patellofemoral pain syndrome. If patellofemoral pain syndrome persists and you keep getting that bad pain, that pressure back there, you can actually destroy the cartilage behind the kneecap. And at that point, they'll find it on an x-ray and they'll call it chondromalacia patella. And that happens typically from 25 to 35 years of age. So there's chondromalacia patella. And it's the same exact process. Big quad muscles are yanking up this bone right here, the kneecap, and it's rubbing, except it's been rubbing for so long that now the cartilage behind the kneecap is shrinking or thinning out. That's what chondromalacia means. It means cartilage is shrinking or thinning. If this problem continues to persist, then the next problem in line that you're going to experience is going to be from 35 to about 45, even 50 years old. You can get something called meniscus tears. And a meniscus is cartilage that's between the thigh bone and the shin bone. It's this bluish thing here that I'm wiggling around. It's thick pieces of cartilage. You have one on each side within one knee, and it helps to cushion the shin bone and the thigh bone on each other. But if you have a lot of compression because these quad muscles are too strong, too dominant, then over time they start to wear that cartilage down and create a meniscus tear. If this same problem persists, then what you'll find happens next after that into your, from 50 to about 70, 2 decades here, is something called knee arthritis. And in knee arthritis, this is when you start out with healthy looking cartilage in your knees. So just so that you're oriented here, the kneecap is removed on this little model. It's taken off, so it's that same cartilage that's right there. They've made it bluish for you. If you keep getting compression there's your meniscus. Then you can start to get damage to the cartilage, and eventually it starts to look like this where you get damage on both sides, and then like this where you get something called osteophytes or bone spurs because the bones are being smashed and they're adapting to all those forces you're putting in. The cartilage is now worn down because of the constant smashing through the joint, but it's because of those overdominant quad muscles. Now in reality, the cartilage in your knee is gradually wearing down. So just to give you an example, this is a healthy cartilage knee. So you're gonna have, it's going to look like this right here, where if you have Osgood-Schlatter's or patellofemoral pain syndrome, the cartilage on your thigh bone is going to probably look healthy. It's the kneecap that starts to get affected right here. And then at here where you have a meniscus problem, then you might also have some damage to the cartilage here. And then these two are going to sit at about this age right here. It'll progressively get worse faster as you age more into your 70s. So now what happens beyond 70 years of age? If you end up getting a knee replacement, because you can have surgery at many points, especially right here, this is where people often will get surgery, they'll get a knee replacement, then you can still have pain after, beyond right here, I'm just gonna write a plus sign, after having the knee replacement, and we'd call that chronic knee pain after a replacement surgery. This is when there's nothing that could be done. Sometimes you might have another surgery. I'm just going to underline it in red, meaning that's a surgery. And that the second knee replacement is a sign that you still have some root problem that is not being addressed. And I forgot to mention as well, I just want to make this clear, you also have other conditions present. Between the ages of about 13 to mid 30s, like right here, you have something called ACL injuries that occurs very often. And it's not uncommon for people to have surgery here. Sometimes people will have an arthroscopic procedure for chondromalacia patella, and it's very common to have a meniscus surgery as well. All of these are surgery situations. ACL injuries, chondromalacia patella, a meniscus tear, definitely knee arthritis, you get the knee replacement. TKR is what they usually call it, and then you might have a second TKR if you still have recurring problems. If you walk into my office, I immediately look at your age, I look at how you're moving, and I can tell you which kind of problem you're gonna have based on this information that I've just presented to you. Now, it's not clean cut, like at this age, you're automatically gonna start having a meniscus tear problem or an arthritis problem. There's definitely overlapping time periods, and it can also relate to how active you've been. In other words, if you've been more of an athlete, if you've been doing a lot of running sports, then you're probably gonna shift this entire timeline into your younger years. It's more likely that you're gonna get things like a meniscus tear or a knee arthritis 5 or 10 years younger than what I drew you on this board right now, because you're just wearing through things faster with a muscle imbalance. And that's what I wanna highlight to you, because here's how you can fix this whole situation. Let me show you this picture. If you look at the graph here on this line, we're going to say this is your strength line. So how strong you are. And if we specifically look at your quad muscle strength on the front of your thighs, and then your glute strength, and we'll just say that they're both high in your earlier years. What happens is, especially in Western cultures where you sit a lot, like you start grade school, you're going through high school sitting a lot. Then you might be sitting in college after that. Then you might have a job where you're sitting. When you sit, you don't use your glutes very well. In fact, they're in a stretched position and they're more likely to get weak over time. So the line is gonna look like this, where it's just gonna go down, down, down. And after a couple decades of sitting, it flatlines real low. Unless you're actively working on keeping up your glute strength goes down to the point where people don't even activate their glutes. If you're in your 40s or older right now, 50s, 60s, and you think to try to tighten your glute muscles and they don't activate very well, this has probably happened to you. But you're still active, you're still moving around, you're still living life, you're still maybe even exercising. So how is it that you're doing that? There's other muscles that have compensated to allow you to be active enough and strong enough to stay on your feet and do those things. It's your quad muscles. So what happens on this line is quad muscles stay strong, sometimes even get stronger. But once you hit that zone of knee arthritis, pain starts to happen more consistently in the knee joint, and then you start to decline in your quad strength, and it goes down even with the glutes. In this zone right here, between the orange and the blue line, this is what I call the muscle imbalance. And it's in this muscle imbalance where you are putting too much pressures in your knee joint, because those quads are overactive and they're yanking this kneecap against the thigh bone, and then because of the attachments to the shin bone, it's yanking the shin bone up into the thigh bone as well. And so it's smashing things along the way, causing Osgood-Schlatters in your younger years, patellofemoral pain syndrome when you're a little bit older. Then it wears down the cartilage behind the kneecap, causing chondromalacia patella. Then eventually your meniscus starts to get squashed and that gets hurt too. Then the whole thing becomes injured and you start to wear the cartilage away. That's knee arthritis. Then you get the thing replaced, but if you don't fix the muscle imbalance because the thigh muscles, the quads are too strong and your glutes are very weak, then your replaced joint in your knee also becomes injured and you have to have a second knee replacement. And if you had an ACL injury in your younger years, chances are you're also very quad muscle dominant, and it's causing your knee to move in a way that causes you to put too much tension through your ACL, and it's very often related to weakness in your glutes. And if you had a surgery because of the ACL, it's just gonna progress all this stuff much faster. Guys, if you have knee pain, you can look at this chart and predict what kind of knee pain you're going to have and when you're going to have it. Please fix a root problem so you can stop this whole process. And the way that you can fix the problem, even if you're in your younger years and you're dealing with Osgood-Schlatters or patellofemoral pain syndrome, or you're in your older years and you're looking at getting a knee replacement because your knee arthritis is getting out of control, you need to fix your glutes. If you can get stronger glutes and fix the compensation so that you can take pressures off your kneecap and off your shin bone and meniscus, then you're going to be in a better shape to be able to walk, do the things you love, and keep living your life without having to get an unnecessary knee surgery. The glute weakness problem that causes the muscle imbalance is about 80% of the problem for most knee conditions. The other 20% is very often related to a knee alignment problem, and I teach you how to fix it in this video right here. It's called How to Fix Your Knee Pain in 2 Minutes.